Whether your cesarean section was planned or it becomes necessary at the last minute, it helps to understand what goes on when your doctor surgically delivers your baby.
If your baby is delivered by cesarean section, you're not alone. About 30% of babies born in the United States make their arrival this way. Some women walk into delivery already slated to have a cesarean. These high-risk moms may have placental problems, a breech presentation baby, a multifetal pregnancy, or have had previous uterine surgery. Women who are HIV positive or have an active genital herpes infection may also require a C-section, so as not to pass the virus on to the baby. More frequently, though, a C-section is not scheduled in advance. If a woman's cervix doesn't dilate properly, or if the baby's head is too large to fit through the pelvis, a cesarean section becomes necessary. Other in-the-moment problems can also lead to emergency C-sections, such as fetal distress, a ruptured uterus, or a too exhausted mom. So what happens during the procedure? First, anesthesia is administered. Most often, you'll get an epidural or spinal block which numbs the lower half of your body while still keeping you awake. If you're having an emergency C-section, there may not be enough time to place an epidural, in which case you'll be put to sleep with general anesthesia and wake up with a baby. Once anesthesia is administered, a catheter will be placed into your bladder and a drape will rest on your abdomen. This is so you don't have to see the incision. The doctor will make a horizontal cut just above your pubic hairline to start your C-section. After several minutes, your baby will be lifted from your body, no worse for wear, and without the pointy cone head of babies born vaginally. Your surgeon will then cut the umbilical cord and stitch you up, a procedure that can take up to 30 minutes as each layer of tissue is mended. The recovery from a cesarean section usually begins with 3 days in the hospital, followed by 6 to 8 weeks of rest at home. Because a cesarean is a major surgical procedure, your mobility may be limited as you recover initially. You may also experience similar symptoms to moms who deliver vaginally, including cramping in your uterus, bloody discharge, and fatigue. Of course, as you wait for your post-surgical symptoms to pass, you can enjoy getting to know your new arrival, a worthwhile reward if there ever was one.
To learn more, check out other videos and articles here at sexhealthguru.com.